A study finds that automation is ruining people's lives and raising mortality rates. That in a report at Study Finds, where we invite you to like and subscribe to get the latest information. Death by robots might seem like an unusual cause of death, but as robots replace people on factory floors, there's been a rise in suicides and drug overdoses, especially in people between 45 and 54. Prior research has estimated a loss of 420,000 to 750,000 jobs during the 1990s and 2000s, most of which were manufacturing jobs. Professor of sociology in Yale's Faculty of Arts and Sciences, Rourke O'Brien, said, quote, "For decades, manufacturers in the United States have turned to automation to remain competitive in a global marketplace, but this technological innovation has reduced the number of quality jobs to adults without a college degree, a group that has faced increased mortality in recent years." He went on to say, "Our analysis shows that automation exacts a toll on the health of individuals both directly by reducing employment wages and access to health care, as well as indirectly by reducing the economic vitality of the broader community," unquote. The team tracked U.S. industries transitioning to automation between 1993 and 2007. According to researchers, for every industrial robot per 1,000 workers, there were about 8 deaths per every 100,000 males between 45 to 54. There were also 4 additional deaths per 100,000 females in the same group. One association found in the study included an elevated increase in suicides among middle-aged men. They also associated the rise in automation with drug overdose deaths among men and women between 20 and 29. The senior study authors said, quote, "A strong social safety net and labor market policies that improve the quality of jobs available to workers without a college degree may help reduce deaths of despair and strengthen the general health of communities, particularly those in our nation's industrial heartland." There's so much more detail in the link in the description below on this and other studies at studyfinds.com.